all, my name is Blanca Beltran. I am here to discuss the public health issue of limiting the abuse of prescription drugs. Implementing a policy of the limitation of prescriptions after a common surgery is vital. Many young adults and children are in danger from dependence of these medications. After an individual gets surgery, a doctor prescribes narcotic medication to help with the recovery of the surgery. Although I believe that there's not much observance after the surgery and how much the patient is taking of narcotic medications. If a patient gets a gallbladder removal and is giving narcotic medications, I personally believe that there should not be refills on those narcotic medications. If the patient feels the need to get more refills because they are still in pain, the patient should go into the doctor's office, discuss their concern, and the doctor should take the initiative to go over some questions to determine if more narcotic prescription is necessary. Oftentimes, the doctor can give something else rather than a narcotic medication to the patient to help alleviate the pain and also to stop the need of dependence of this medication. The evaluation of the prescription of medication is vital. 1 in 20 young adults are on opioids for way too long after surgeries. Our adults are not the only ones at risk, but now children are becoming opioid dependent as well. The University of Michigan stated that in a research that 5% of children continue to receive refills way too long after surgery, and oftentimes it is not needed. In this new policy, there are to be limitations on refills. If it's thought to be necessary, the doctor is to limit the prescription of narcotic. The most commonly abused medications are Vicodin, Percocet, as well as codeine. Narcotics are not the only type of abused medications, but such as others, such as depressants, such as Xanax, Adderall, that help certain type of mental disorders. Being able to evaluate this issue is crucial for the country and for the nation, as we are seeing a lot of deaths due to this issue. This issue affects everyone in the United States, and many can become addicted and dependent on these narcotic medications. This is causing individuals to turn to heroin when pain medications are no longer being prescribed. Opioids account for 70% of the drug overdoses. The CDC also estimated a 75,500 deaths in 1 year due to the abuse of narcotics. Which it has increased in approximately 10% in the last year. The rise in opioid has happened in waves, where the first prescription, when the first wave was prescription, then heroin, then synthetic fentanyl. Fentanyl is accounting for many deaths in the United States, as many are becoming addicted and having no control of this substance. The ones that will be affected by this policy will be the doctors, who will have to make and sign a consent to prescribe, in which he will be monitored for now how many narcotics medication he is prescribing, as well as the patient if needing to receive more narcotic medication will have to go into the office to address the concern and be evaluated if the need is actually needed. The policy is going to be set to monitor and become more strict on the regulations to ensure that proper monitoring is being developed and limiting the dependence, and make sure that it's being looked at. This abuse of narcotic can be stopped, but it needs to be a team effort. Healthcare providers, federal regulations, and state regulations are vital to making sure that this stops. This is a major public health crisis that is getting out of control. There will need to be a joint contribution by working with the public health professionals as well as federal and state officials and healthcare providers to ensure the establishment of this policy. The cost of narcotic and drug abuse to the nation is about $151.4 billion. If effective prevention programs are set, the cost would become $1.5 million. By doing this, would decline $1.5 billion. By doing so, these programs will help individuals recover, go in, get evaluated, and if they are independent, they can have recovery and medical programs to help them on the road to recover. This policy would cost $220 million, but it is nothing compared to the $151.4 billion that it has to the cost of medical to the nation. Narcotic issues are huge in our youth. Our youth is our future. They are our future. We need to protect the young. We need to protect our young adults from narcotic dependence. It is something so simple that we can monitor, especially if we can prevent it after surgery, because that is where it starts. It starts from a common surgery, then getting these prescription medications, they become dependent, they no longer get prescriptions, so they turn to heroin. This is something that as a nation we can stop. We all need to work together on this. And as legislators, we have to take this into consideration that no matter the cost of the $220 million that this will cost the nation, it is nothing compared to the $151.4 billion that the nation is being cost due to this addiction crisis. We need to work together as a legislation to stop and prevent this addiction. Not only is it costing us, the nation, a lot of money, it's costing a lot of lives, and that is most important. Lives, family members are in distress, are recovering from pain due to the fact that they are losing loved ones to prescribed pain medication. As a nation, we need to work together, and we can stop this, but we need to work together. Thank you so much, and I hope that you guys vote on my policy, as this is something as a nation, as legislatures, we can stop. Thank you again, Blanca Beltran.